Hello, I'm Caroline from In-Home Care, and in this short video I'm going to answer the top frequently asked questions about how you can work with us at In-Home Care. Becoming a support worker for In-Home Care is a prestigious and professional career path. Our support workers work in the local community, assisting clients in their own homes and helping them to continue living independently. A support worker can be literally anyone who is a caring person, ranging from someone with absolutely no previous experience of caring to those who have previous experience of caring for a loved one and felt such a sense of fulfillment they pursued caring as a career. Some support workers are born to be a carer and just love being able to support people to live an independent life. Others are working in care to fit in with their family or lifestyle, enjoying the freedom and flexibility this job provides. As a care provider, our team of support workers work alongside all other healthcare professionals in the wider community. We work alongside district nurses, local GPs, ambulance crews, hospices, and the NHS continuing healthcare. Our elderly clients require many varying aspects of care to retain their health and independence staying at home. This can be general companionship visits, having a cup of tea and a chat, going out in the car and driving to the beach for ice cream, or accompanying them to hospital appointments. We also perform light domestic duties and can assist in preparing and serving meals. Personal care such as showering, dressing, medication and daily self-care is quite common. Other clients require more specialist care and support, for example, end of life, advanced dementia care, through to specialist support with food and fluids. We provide training to suit the needs of our clients and further support our carers to advance their understanding and training as required. We specialise in all types of care such as disability care, learning disability care, elderly care, dementia care and companionship care. We create a personal package for our clients, whatever their needs, however long they need us. In-Home Care offer 3 types of care packages to our clients: hourly, overnight and living care, which means our support workers work varied times during the day. Some work part-time and others full-time. We can offer flexible hours depending on your availability. Hourly care allows our clients to receive help every day without the need of a full-time living carer. This is ideal for our clients who wish to keep their independence. Our hourly care visits range from as little as 30 minutes to an hour plus, generally working between 7 a.m. to 10 p.m. The service and duties include personal hygiene upkeep, dressing, administration of medicine, excluding injections, housework, shopping, preparation and serving of meals, and companionship at home or on trips. Other common tasks are picking up pensions, prescriptions, and keeping administration up to date, including paying bills. Overnight care is essential for our clients, whether it's getting to and from the toilet or having somebody close by, especially for those suffering from dementia, which can leave the individual confused and prone to falls and accidents. Our overnight carers offer options of awake care and asleep overnight care to make sure our clients and their loved ones are taken care of from dawn till dusk. Our awake carers stay up through the night to guarantee the client's safety. If the client is especially frail or suffers from dementia, this is a reassuring option, as they'll be awake from the moment the client goes to bed to the moment they arise in the morning. Our asleep carers, although providing the same service, will have a provided bed in the client's home to sleep. They will assist and support the client when they wake and call for assistance. Our discreet support workers live with the client in their home and make sure everything is taken care of, providing the same level of support as all of our other carers by assisting the clients to remain independent at home, alleviating the need to go into a care home. This support may be for 1 week or up to 3 months and even beyond. After this period, the support worker will usually break for a week or 2 and go back to their own life before returning to the client. The live-in support worker would usually be available and on call approximately 21 hours a day, with a clear 3-hour break every day during daytime hours. Overnights are usually in a toilet wake-up call once, maximum twice in an evening. Should the client require more awake time overnight, then we would provide an overnight awake carer to give extra support. This is a great position to take if you are living alone yourself and wish to have a fulfilling life by providing support to someone else who may otherwise have to move out of their home. Full training and support will be provided for all levels. Regardless of experience, all our carers are enlisted on our approved training and shadowing programme where they gain recognised qualifications. They each have 24-hour access to our supportive management team who are always on hand to answer any questions, providing emotional support and even help with directions if they get lost. Support is the key. We want our carers to feel confident in their ability when they go out on their first shift, and we will do everything required for this to be the case. We also offer specialist training in any area our carers would like to develop their skills or to provide bespoke care for the needs of a client. We actively encourage further education in the field of care, whether this is through the local colleges with diplomas in health and social care or specialist care via NHS support, such as peg feeding. We offer paid training all the way through to becoming a level 5 in management, which is a standard qualification required to become a registered manager. All our current managers have worked their way up within home care to this prestigious level, many starting out as a carer themselves. We are proud of our reputation in the care industry we've attained for supporting our staff. As can be seen on our Facebook page, reviews left by countless staff employed across the years. We use company software to rota your schedules each week based on your availability. Your rota is then sent via email to you on a Wednesday, covering the following 10 days. You can also access this at all times on our in-home care app on your phone. The office senior team, care coordinator, or managers can answer any queries you may have about your rota or the care involved. The app on your mobile includes everything required about the client you're attending. If they are new to you, you would read about who they are and the exact duties required of you during the call. Your day would start as per your availability. Check in the app for any updates before heading out. Once you know your schedule, you would arrive at your first call, fully prepared with full personal protective equipment, such as gloves, masks and aprons, and having already checked the care plan of the client you are visiting. The day would continue in this way, with a few breaks, usually between calls, until you have completed your shift. Every client has been assessed by our management team prior to a care package starting. The care plan will then be drawn up, and this will contain everything the client needs and wants. This is called a person-centered care plan. Usually this care plan will be agreed upon by all involved, such as the client and their loved ones, and social services if they are involved. The full details of this care plan will bullet point everything that needs to be completed during the allocated time spent with the client. A snapshot of the care plan will also be provided on the In-Home Care mobile app, and the printed fuller description is available in a pink folder within each client home. Care plans can change as circumstances change that maybe you yourself have reported. They are also periodically reviewed by management and updated accordingly. We care for adults over 18 years. We have a variety of clients, ages, genders and care needs, with the majority being elderly. Types of care calls may include general help, living independent as possible, involving washing and dressing, helping getting out and about in society, maybe attending a doctor's appointment or a stroke club, for example. We also have younger people who have been involved in a traffic accident and suffered paralysis or other life-changing needs. We can care for a couple who may have different needs. The husband may require help with his breakfast and getting his morning paper, whilst his wife with dementia may need help with dressing and remembering her medications for the day. The majority of our carers have their own reliable transport, such as a car or a moped. If you do not drive, we have suitable routes for cyclists and walkers. COVID restrictions depending, you can car share and work as a team. Our clients usually live within a 5 to 10 mile radius of each office. We try wherever possible to keep your calls as close to each other as possible. It is in your interest and ours to keep you local. You get to see more clients whilst we get to keep your travel costs to a minimum. There are occasions that you may be asked to travel further afield. For example, if a client lives in a more rural area. If this is the case, travel time and fuel are taken into consideration. You will be trained on how to deal with most usual and some not so usual situations before starting out working with us. And there is always a member of the senior team at the end of the phone, day or night, to talk and guide you through. You're never alone, and if required, we will send someone out to support you. Unlike many other providers, we do not wear a uniform. We conducted a survey that showed the majority of clients would prefer the support workers in non-uniform, keeping discretion and judgment of neighbours. We suggest wearing comfortable, suitable clothing in line with health and safety and infection control, such as closed-toe shoes and short sleeves. We discuss clothing in your initial training and explain what is and is not appropriate. Generally speaking, our carers prefer to wear comfortable jeggings and leggings and short sleeve tops with a zip-up jacket, which they can take off easily when arriving at our clients' homes. Full personal protective clothing is provided, including masks, aprons and gloves. In short, yes you can, where there are adequate double-up care calls available. Our carers build up great working relationships whilst out in the field together. We do have double-up care calls, so you will get to work in doubles from time to time, following safeguarding protocols. The standard rate varies between branches, and you would need to check on our website for the latest rates being paid today. We offer higher rates for early shifts up to 8 AM and the late shift 7 PM onwards. An even higher rate is paid for weekends, and the highest rates being paid weekends, early and late shifts. You will be paid in full on the 7th of every month for all care calls completed, including all mileage from the previous month. We check our rates constantly across the sector to ensure we are always one of the top paying domiciliary care companies. We also have running incentives and bonuses throughout the year. Yes, you get paid 35 pence a mile, and we pay a higher rate of pay to cover any time lost to travel to any further afield clients. Your mileage is worked out for you from our software system. The system knows which calls have been allocated to you and how far between calls, therefore saving you time, as you do not need to submit a mileage form to claim back. All holiday entitlement and pay are worked out using the UK government calculator, and everyone is entitled to different amounts of holiday pay based on how many hours worked. Regards to sick pay, we pay statutory sick pay to everyone that is entitled to this. We are also part of the government pension scheme. If you choose to opt in or out of the scheme, we support your decision. In short, yes we can. You tell us what hours you're available, and then we can work together to build you a suitable round. If you let us know what restrictions you have, we will look for a way to work with you to get the hours that work for your entitlements. We have carers who can't do more than 16 hours a week, so we will ensure you get the hours you need to claim your entitlements. Many of our carers have preschool and school-aged children, and finding a local, reliable childcare provider is so important. If needed, we can point you in the right direction. Some carers are lucky to have their grandparents, partners or friends available who can care for their children on set days or nights during the week, allowing you to work set days and times throughout the week or month. We will always try to be as flexible as possible and work with you to find a way that works around you and your own individual circumstances, as well as the needs of our clients. This may take some compromise on both sides. Caring for others as a profession requires us to be available when clients require the most assistance, early mornings, evening and weekends. We ask that you give at least one evening a week and some hours every other weekend. This ensures we're keeping the service safe and everyone gets the care that they need. We have an amazing team of reliable care workers. All we ask is that everyone does their fair share and picks up as many hours over Christmas and New Year as they can, usually on a 1 year on Christmas Day and 1 year off Christmas Day rotation. We do offer part-time shifts over the holiday period, and this works really well. The most important thing is the clients get the care they need and our carers get time at home with loved ones. We make it attractive too by paying double time for Christmas Day, Boxing Day and New Year's Day, and time and a half for every other bank holiday throughout the year. We have various incentives running throughout the year. We have regular care of the month and run a care called bingo. Numbers are given for working extra shifts or covering sickness, all of which you receive Love to Shop or similar vouchers. We also run a rewards scheme when you can get rewarded for passing mandatory spot checks. Bronze, silver and gold bespoke in-home care badges are presented along with a certificate and monetary vouchers equaling £25, £50 and £75. If you take a look at our Facebook page, you can see what our carers receive. They love winning their awards, and the monetary gain is always a welcome addition to their pay. New for 2022, here at head office, we have our top 20 Carer Awards, which will kick off this coming January the 1st. where every carer has a chance of being in this elite list of carers celebrating Christmas 2022. Winning amazing cash prizes and getting all the recognition this prestigious award brings. These awards will be point-based and shall recognise carers' efforts across a broad spectrum of considerations throughout the year. More details are to be released soon. As a member of the team, you will have one-to-one supervisions every 3 months, a yearly appraisal with our team meetings being held every quarter. Aside from these points of contact in which you are actively encouraged to feedback, we pride ourselves on having an open door policy for everyone, staff and clients alike. Our seniors and management and even the directors are all happy to be contacted via phone, text or email, and a virtual or face-to-face meeting can quickly be arranged whenever you feel the need. Our care workers are absolutely the most important aspect of the whole company. They are the front line. They need us to listen to their concerns and act on them appropriately. Ultimately, if our carers are not happy, our clients won't be happy. Our team meetings include everyone, and they are held at the local branch every quarter. These meetings can last anything up to an hour and a half, which you are paid to attend. We cover updates within the company, the latest news, what is working well, and areas where we can improve. Any charity events that are coming up, amongst many other things. These meetings are inclusive and they are designed for everyone to discuss anything they feel is relevant, or if preferred, we can stay behind afterwards for a one-to-one. Our values are heart, honesty, empathy, accomplished, reliable, and teamwork. We believe everyone, no matter what their age, colour or beliefs, deserve to have their needs met with understanding and compassion, to feel cared for, loved and looked after. Our aim is to provide you with the highest quality in care services and to provide you with the care we would expect ourselves. The Care Quality Commission are our main regulator. They inspect care providers and ensure we are following the regulations in the best interest of our clients. They ensure that all registered care providers are providing the best possible care at all times in a way that you would expect for yourself or a loved one. They may choose to call a few of our carers to ask them how they are finding their role and the company. In-home care have many opportunities for progression. The directors actively encourage staff to upskill and take advantage of the paid diploma qualifications we offer. One of our employees started as a senior carer within home care and then progressed to operations director. She now oversees the daily running of the whole business, which includes 3 director-owned branches and 9 franchise branches across the UK. We provided 100% support for her to complete the qualifications required for the role and have ongoing training and support, upgrading her skills to keep her up to date with the latest developments. At In-Home Care, it is very possible for opportunities to open up at other branches, and you can move between roles to suit your lifestyle and progress your career. Hourly, overnight and living care support worker, senior carer, field care supervisor, head of seniors, deputy manager, care manager, care liaison, client welfare, registered manager, admin and reception, finance admin, social media and marketing, training coordinator, carer mentor, recruitment and retention. Many new opportunities do often become available, and you can check the latest availability on our website. We now sell the business model. As a franchise, you receive the full backing and complete company support. As a franchise owner, you would benefit from all our team's knowledge and past experience and bring it to your own home care business. We welcome anyone who has an interest in the growing sector, even if you have no experience. Get in touch and find a little more about running your own in-home care business. We believe that you will not find a more supportive, understanding and forward-thinking care company. We generally want our carers to be the best of the best, and as such, we ensure we pay a higher remuneration than other care providers in the locality. We provide high quality in-house accredited training written by us, for us, and we have a strong professional team of dedicated office staff and seniors / management to support you out in the field. We value exceptional care, ensuring we show our appreciation daily through thoughtful comments in person or via social media and via our monthly ongoing care awards, carers bingo and other exciting incentives run throughout the year. We enjoy providing opportunities within home care for all staff. As strong believers in promoting from within, we help you reach your professional goals. We ask for regular feedback from both our clients, their loved ones, and our carers to find out how we can improve what we do. Then, critically, we act on this information quickly if it is in the interest of all. We don't wear uniforms, which a lot of carers and our clients prefer. Freedom of choice with dress sense and not looking like a carer are highly acclaimed incentives to work for in-home care. Our clients also prefer that they are not highlighted as in receipt of care by their neighbours or passers-by. We have a very low staff turnover rate of only 32% compared to the industry average of 43%, with many of our staff being with the company for many years. Many staff who do leave for pastures new are soon knocking on our door again to come back, often saying they thought the grass was greener elsewhere, soon realising how good our team are and how well they were supported at in-home care. We are happy to see good people come back to us and will always do everything we can to make this happen. High rates of pay within the industry, fuel and pension allowances, holiday and sick pay, professional, friendly and supportive management team, regular ongoing supervisions and appraisals, additional training as is required, 24-hour live access to a real person, WhatsApp, email, text, call availability, full professional support in every situation, ongoing professional training, career progression, options to move around our different branches, no uniform, recognition and rewards program, easy to use mobile apps for reading care plans, CQC good rated provider, personal protective equipment is free and plentiful, wonderful clients to care for. Initially, we have an informal chat. This will be with one of our recruitment / admin team or a senior / manager. If the position sounds like something you are interested in and we have accepted you, we would progress this to the next stage of sending out an application form via email and booking in an interview. This can be held virtually via Teams or Zoom or face-to-face at your nearest branch. You will need to complete and send the application form or bring it along on the day of your interview. At your interview, you will need to provide your ID and proof of address. This will be in a form of a passport, driving licence and bank statement. If you have been offered the position, we will need to verify your DBS update number, or you will be requested to pay for your criminal record check, DBS, which will be reimbursed on request once you have passed a 3-month probation. All your mandatory training and shadowing will be booked in to prepare you for your start at in-home care. Many people have made small mistakes they regret later in life, and as an employer, we do not discriminate. So please disclose any concerns and we can discuss further. Depending on the record, a decision will be made. We check all our staff's criminal records, and any disclosed records will be risk assessed appropriately. Absolutely, yes. Many of our support workers cared for a loved one before becoming a professional support worker. We are delighted to welcome all carers with this type of experience. Many of our amazing carers did not come to us from a care background. This does not matter at all. More importantly, we look at all the values of the person and their reasons for wanting to take care up as a career. We provide a full support, training and shadowing shifts for beginners, not only doing recruitment but ongoing throughout your employment. You will no doubt understand, as a regulated care provider, the Care Quality Commission require every care provider to fully vet all staff before starting work. From taking a full employment history, requesting character and employer references, we also need to know past name history and 5 years of addresses, checking ID, to having a full enhanced DBS check made. All these checks will be completed before starting work in any care setting. Easy, I have provided a link below. Click the link, complete all the details and click submit. We will be in touch shortly to have an informal chat. If you like what you hear and you are looking like a good fit for the position, we will send you an application pack and invite you along for an interview, either face-to-face or virtual. Other ways of contacting us are via Facebook Messenger, calling our office number on 02392 880004, or emailing us at info@in-homecare.co.uk. Healthcare professionals and our own staff highly regard us as a top care provider in the industry. If you like what you have heard, we would love to hear from you. Please get in touch today. We have people waiting to speak with you.